Hi everyone. Today we're going to talk about the phase in women's life, the transition through the perimenopause and also menopause. Many women in their late 30s, 40s, and 50s start experiencing unexplained fatigue, sleep issues, weight gain, and mood changes. Often these symptoms are dismissed by just normal aging by traditional setting. And it could be just treated with isolated system using antidepressants, statins, metformins, and some other medications. But today we're gonna take a look at the integrative biology of what's actually happening in your body and how we can take comprehensive approach to protect your longevity and restore your quality of life. To understand the midlife changes, you have to look at the three biological clocks that operate like overlapping waves: your circadian clock, your stress HPA clock, and your reproductive clock. In a healthy adult, these oscillate in perfect harmony, but when one falls out of phase, the others follow within weeks. This is why you cannot just treat one symptom in isolation. And if we treat only your sleep or only address your stress, the other broken clocks will just pull your system right back into dysfunction. Let's start with sleep. How many of you probably had an experience waking up between 2 to 4 a.m., feeling hot, or experiencing morning fatigue even if you were in bed for 8 hours? This is just not the sign of getting older. It's an endocrine issue. As you enter perimenopause, the decline of estrogen and progesterone collapse your deep sleep. Progesterone is naturally calming for the brain, and its loss is on a cause of the midlife sleep problems. When your deep sleep fragments, your brain loses its ability to clear out metabolic debris, and which directly impacts your cognitive health and accelerates aging. Next, we look at the stress axis, which is driven by cortisol. Cortisol is not just a stress hormone, it's a biological aging signal. When you're constantly stressed or when poor sleep drives up your evening cortisol, it accelerates cellular aging, drives weight gain around the midsection, and creates systemic inflammation. Over time, this chronic stress leads to the allostatic load, the wear and tear on your body that can actually create 3 to 7 year gap between your biological age and your chronological age. And the good news is that with the right intervention, this accelerated aging is completely reversible. This brings us to the decline of our sex hormones, estrogen, progesterone, and testosterone. The loss of these hormones in midlife can cause hot flashes, brain fog, joint pain, and anxiety, but it also removes a major protective barrier for your health and metabolism. There's a critical intervention window known as the timing hypothesis. Studies show that starting hormone therapy within 10 years of menopause provides vital cardiovascular and cognitive benefits and can even slow the progression of plaque in your arteries. If we wait until that 10-year window closes, the therapy may not be as protective. And you may be thinking isn't hormone therapy dangerous? And that fear largely stems from the 2002 Women's Health Initiative, WHI study, which studies an older demographic using synthetic non-bioidentical hormones. Modern hormone therapy is fundamentally different. We use bioidentical transdermal estradiol like patches or creams and oral micronized progesterone. Because transdermal estrogen is absorbed through the skin, it bypasses the liver and avoids the blood clot risk associated with older oral medication. And long-term follow-up have confirmed that for women who initiate modern HRT early, it's incredibly safe and actually reduces overall mortality. While we focus heavily on sex hormones and stress, we cannot ignore the thyroid part. Up to 10% midlife adults suffer from subclinical hypothyroidism, which is frequently missed by standard doctors who only checks the basic TSH level. When your body is under stress and inflamed, it struggles to convert inactive thyroid hormone into active thyroid hormone, leaving you feeling exhausted and prone to weight gain, even if your conventional lab results look fine. And a comprehensive thyroid panel is essential for women in this stage of life. So, what is the blueprint for thriving through midlife? It's a coordinated, integrated approach. We cannot just give you a sleep aid or a statin. We must treat the entire system. This means practicing good sleep hygiene and morning light exposure to reset your circadian rhythm, utilizing adaptogens like ashwagandha to lower cortisol, incorporating modern bioidentical hormone replacement to protect your brain and heart, and ensuring your thyroid is fully supported. Untreated perimenopause carries its own massive health risk. Doing nothing is rarely the safest choice. By addressing all these biological clocks together, you aren't just treating symptoms, you are completely changing your aging trajectory. And this is just a quick look of the timing hypothesis, where under 10 years is when you can see the benefit of using the HRT. And here are some labs and some diagnostic tools you can use for your biology: Dutch test, comprehensive thyroid panel, and sleep measurement, morning sunlight exposure, and strict evening blue light blocking can be helpful using adaptogens strategically, and finding a practitioner, fluent in modern bioidentical HRT would be a good strategies. And if you have further question, check my link in bio for and book a call there. Okay, thank you.